An amazing thing. I should say Susan is doing very, very well. She's actually in line now to get a pancreas transplant, which will happen, I don't know when, but she needs that. Then she'll no longer be diabetic and she can go on and do just about anything she wants. I want to introduce you to the guy who did Susan's surgery. His name is Dr. Tayyab Diwan, and I appreciate you coming in.
Sure,
I know
absolutely.
you guys are really busy. In fact, Dr. Tivar, who did my surgery, was supposed to be here as well.
Right.
But he's in the middle of a surgery. Too busy.
Yeah, busy
That's
saving
okay.
lives.
Busy saving lives. I've gotten so many calls, so many emails about becoming a kidney donor. And of course, that was the reason that we wanted to do these stories.
Right.
And people are so concerned. What is the #1 concern you get from people who say, oh, I don't know?
I think that people tend to truly be concerned about the pain. And I mean,
There really isn't that. It isn't that bad.
Well, yeah, I mean, sure, you can attest to that. I mean, you know, we do a pretty good job of controlling that and making sure that people feel comfortable. And you know, I've never had a donor really kind of get to the point where they had to stay in the hospital because their pain was out of control.
Right.
And you know, always the other issue is people are concerned whether or not they're going to live a normal life with only one kidney.
So many people do when they don't even know it, by the way, right?
Exactly. And then, you know, when we do you do a CAT scan on somebody for something else and you find out they only have one kidney and they'll live a life without it. And all of our studies show that people with one kidney after donating have the same risk of, you know, heart disease and, you know, even renal failure as everyone else.
Meanwhile, there are people literally dying waiting to get a kidney.
Right.
How bad is the need?
You know, we have over 100,000 patients awaiting transplant.
100,000 just in the United States.
Correct. And I mean, you know, there's clearly an organ, you know, you want to call it an organ shortage. And I mean, I think that's when we started going to living donors. And once we figured it was safe, that we really try to push that because, you know, it helps to not deplete the deceased donor pool, and it truly, you know, brings in a lot of value to these recipients who otherwise, you know, may have to wait 4 or 5 years for a kidney.
I got to say, we were discussing this before. I talked to the transplant coordinator I worked with, Paula. She said about a half-dozen people have called since yesterday, interested.
Fantastic.
Is that fantastic? Is that a good number? And thank you all of you who do.
Yeah, I mean, I think it's a fantastic thing. I mean, this is why there should be more of these. We really need to do a really good job of letting people know that it's something that can be done safely and that, you know, really will help people's lives.
In fact, it's been going on for how many decades now? They've been doing
it's been a good, you know, we've been doing kidney transplants for many decades. And I mean, living donors, again, we've been doing for many, many, many years. And, you know, we you know, rarely does anything ever go wrong. Right. And so it's really great.
I'm living proof. It's really easy. I promise you. There's so much more on WCPO.com/life changer. If you want, please go there, check things out, see how Susan's doing, a whole story there on that as well, and much, much more.